Good morning, everyone, and welcome back to our next session at Maine Public Health Association's annual conference. And welcome anew if you are just joining us. I'm excited to have three presenters with us this morning to talk about you can't fix the health system without fixing the food system policy solutions. Before I let them get started, just a reminder that closed captioning is available beneath the video if you would like that, or you can hit the pause button if you don't need it. Please take the evaluation at the end of this session and at the end of every session by completing using the feedback button in the upper right-hand corner. And we will take questions at the end of the presentation. So please feel free to chat those in using the Q&A feature as we go. But for now, I will turn it over to our presenters. Thank you so much for being with us this morning.
So hi, everyone. Welcome. Welcome to We Can't Fix the Health System Without Fixing the Food System Policy Solutions. And I have to say, when we originally submitted this abstract, the title was You Can't Fix the Health System. And we purposefully changed the title to We. And we just want to kind of keep that flavor and theme throughout, that this is very much a we movement. So welcome, everyone. My name is Renee, and we're going to kick off the session with a quick poll. So the question is, how do you feel about policy making? And your choices are, I love it. Policy is where the action is and how we can change the world. Meh, it's necessary, but I only pay attention to issues that matter to me directly. Or I hate it. I like eating sausage, but not making it. So we'll launch that, and you can all be chiming in on your feelings about policy making. And we'll go ahead and get started. Next. Great. So here's our disclosure. And it is that we have nothing to disclose with regard to commercial relationships. Next. And now, while you're all doing the poll, and we'll look at those results in a minute, I just want to introduce myself a little more. My name is Renee Page. I'm Executive Director at Healthy Communities of the Capital Area, and we're home to the Maine Farm to School Network and Maine Farm to Institution, along with a lot of other community-based public health initiatives. And I just want to also point out that Maine Farm to Institution is home to the Maine Food Policy Work Group that Ken will tell you a little bit more about in a few minutes. And but to get us started, I'm going to do a little bit of framing for our presentation, and then Anna and Ken will dig in a little more. And then at the end, of course, we'll have time for Q&A that I think you can plop into the Q&A section of the conference platform. And wondering if we can see the poll results. Looks like if we click here. I'm not seeing the results, but wondering if others can. Oh, here we go. All right, looks good. People like making sausage. But I just want to say, we're not going to dig into too much today about the how of making policy, but just the importance of it overall. And we also, I just wanted to frame too, that we're not going to be talking a whole lot about federal policy, but there's certainly a lot to dig into there if you're interested. You know, from things that come up every 5 years pretty regularly, like the dietary guidelines for Americans and the Farm Bill, child nutrition reauthorization. And then, you know, there are new bills that are definitely connected to food systems right now, like the Build Back Better and Kids Eat Local acts. Next. So first, you know, we really just wanted to frame the session and start with a land acknowledgement. You know, I really appreciate Ambassador Dana's keynote this morning to set the stage for us as we talk about food systems today. And, you know, really, we think it's particularly important to pause for this land acknowledgement. You know, given that it's the harvest season, we're talking about food systems and the power of the land as connected to all of that. So our acknowledgement today is that we must acknowledge, as we work toward a more equitable and just food system, that we live, work, and harvest our food on this land we now call Maine. That is the traditional homelands of unceded Wabanaki territory. We recognize and honor the current tribes who comprise the Wabanaki Confederacy and who have stewarded this land for generations. So please take a moment to reflect on the lives and land that were taken during colonial settlement, especially as we talk about developing policies that have direct impact on food access, cultural norms as related to food, and who is impacted most by these policies. Great. Next. Thanks, Anna. So I'm sure this looks familiar to a lot of you. We just thought going back to the social ecological model is a great way to understand the impact of food policy and strategies for how to get to successful change. So public health and behavior change strategies are most successful when each layer of the social ecological model are addressed and can be applied to a variety of public health initiatives. So in fact, I think this one was something I stole from tobacco or physical activity. So there you go. You can apply to many public health initiatives as an effective way to get to change. So individuals at the center of the model are impacted by all the strategies surrounding them as you proceed through the concentric circles, with policy having the most impact. But even though policy can, give us the most bang for our buck, we still need to address the other layers for successful buy-in and implementation. So as we move through the presentation and talk about specific policy goals, be keeping this model in mind. Next. Great. So now we're going to show a short video clip to further frame food policy considerations. And I just want to acknowledge that this clip is from a longer video called What's on Your Plate that was developed by UVM. And the full video is like less than 12 minutes. And we encourage you to watch the whole thing. We wish we had time to show the whole thing, but you can find it at this link, or you can just Google What's on Your Plate at UVM. But for right now, we're just going to show this short clip.
But didn't actually know what it meant. So I did some more homework. Lo and behold, it is not as simple as you'd think. Turns out that people often confuse the term food system with what is just a profit-driven system of production and consumption. That's the way that food is grown, processed, distributed, marketed, consumed, and disposed of. But this production model falls woefully short when considering the multitude of factors that go into sustaining a healthy person and a healthy planet. It's really more layered and complex than that. Several additional factors need to be considered to understand the full impact of the food system, including the social and cultural aspects, the environmental impacts, the economic aspects, and the diet and health implications. Now that I've planted the seed, let's look at a few examples in each of these areas to give you a better idea of what I mean. In social, we have food traditions, treatment of farm workers, and taste and flavor. In environmental, there are farming practices, land use, topsoil loss, and climate change. The economics looks at the consumer's food costs, trade policies, and crop subsidies. And the diet and health category includes diet-related diseases, hunger, and food safety. And that, of course, is just to name a few. The seed way of looking at our food system allowed me to make some sense of this complex web. All of a sudden, I could look at a can of soda and see that it was much more than a drink. It actually involves relationships between government food policy, what is grown, what is produced, and the health and cultural consequences of what is consumed. Once I started looking at the food system this way, I started wondering how our food system got this complicated in the first place. Lucky for me, there are a lot of smart people out there who have already asked this question. What I found out is that we've arrived at the current industrial system of food production because of several factors driving the industry, including government policies and increasing corporate consolidation. But what does that all mean? In the industrial food system, consolidation is not just happening within individual sectors along the supply chain, but a few large multinational corporations are controlling more and more of the entire process. They own or control the seeds, the farms, the trucks, the processing plants, the brands, and the grocery stores. It's called vertical integration. Yikes! This is why the food you find at the grocery store is relatively cheap. But before you get too excited about cheap food, because that would be looking at only the economic aspect and not the whole seed picture, remember all those other areas we talked about. My guess is that once you start looking at it that way, it will get complicated pretty quickly. Even if we just look deeper into the economic aspects, you'll see that there are other costs, such as pollution cleanup, treating illness, maintaining infrastructure, and different kinds of taxes that you and your community pay for indirectly. What else don't I know about our food system? In my search for the story behind my salad,
Great. So welcome back from that. And so we just wanted you to keep in mind later on when we hear from Anna and Ken about some of the specific legislation that we've been working on in Maine, to keep in mind this seed model and how each of these aspects of the food system are impacted and how it relates to public health overall. So of course, COVID and climate change are exacerbating all of this intersectionality of these seed issues as well. So, for example, when thinking about like the social impacts, consider how food policy, like laws that impact agricultural laborers or humane treatment of animals, how that impacts health overall. And for environmental, consider how food production and waste, knowing that we waste more than 40% of all food grown, how does that impact the environment and climate change? And for economic, we know that cheap food is often just that it's low cost, but it's also low in nutritional value, containing ingredients or growing, harvesting, and processing practices that are harmful to our health and planet. For diet and health, we know that diet, the food we consume, is arguably the most significant driver of health or poor health. So, it can be very complicated. Sometimes seemingly things that seem like obvious solutions can make things worse. So, when you're taking a systems approach, looking at every aspect is important. Next slide. So great. Okay, so just a little bit more of Public Health 101 here. These are among the many social determinants of health that play a greater role in the likelihood that each of us lives a long, healthy life than even our genetic predisposition for disease. So all of these social determinants of health play a role in food access and healthy eating, and food policy impacts them all. So for example, right now, Maine's Ending Hunger by 2030 initiative is looking at some of the preventable upstream impacts that lead to people experiencing hunger, like homelessness, income and employment, rurality, et cetera, rather than just focusing on emergency feeding and food distribution. So really getting to the root causes to be able to prevent some of these undesirable outcomes. And then another strategy that came out of the recent Maine Food Convergence was, rather than having policy and advocacy be a standalone priority, participants agreed that policy should be woven into all of the other priority areas. So now I'm just going to leave it here with this basic framing and pass it to Anna, who's going to dig in a little more with some Maine policy initiatives.
Great. Thank you, Renee. Good morning, everyone. I'm Anna Korsen, Advocacy Director with Full Plates, Full Potential. So I'm going to share a little bit of how we have utilized policy to expand access to child nutrition programs here in Maine. So Full Plates is a statewide nonprofit working to address childhood food insecurity by strengthening and expanding child nutrition programs like school breakfast, school lunch, after-school meals, and summer meals. We actually originated from a legislative task force, so we were kind of born out of policy. So we started as a coalition of child and hunger advocates school nutrition professionals and policymakers that were tasked to examine the state of childhood food insecurity in Maine, and then report back to the legislature with recommendations. And we couldn't do any of our work without the strong relationships and collaborations we have developed over time with many key partners and stakeholders across the state. And since our inception, Full Plates and our coalition of partners have focused on policy as a way to increase participation in childhood nutrition programs. And the collaborative nature of our work has allowed us to be really instrumental in systems change efforts. So the reason we do our work is because we have a really high rate of childhood food insecurity here in our state. We actually have the highest in New England, with 1 out of 5 kids lacking access to basic nutrition. And before the pandemic, at least 80,000 Maine students relied on school meals for basic nutrition. These are the children who live in households that are found to be income eligible to receive free school meals, either by way of means-tested programs like SNAP and TANF, or through filling out a school meal application. And I say at least 80,000 Maine students because we know we're not capturing all of the students who truly need school meals to meet those basic nutritional needs. And this is important because food insecurity negatively impacts children's physical, social, emotional, and mental health. It affects learning and ability to concentrate, and ultimately results in big costs to society. And despite the fact that Maine has such high rates of childhood food insecurity and access to nutrition is critical to learning and lifetime outcomes, year after year, we see really low rates of participation in child nutrition programs. And the low rates of participation are caused by the many barriers that are built into the framework of child nutrition programs. So school nutrition staff lack adequate time, proper funding, proper staffing. They're always understaffed. They're always dealing with broken equipment and kitchens that aren't fully equipped with ovens and all of the different pieces that they would need in order to make a meal for kids. And they also tend to lack access to professional development opportunities. And school nutrition programs are chronically underfunded and were designed to be a standalone business with limited or no funding from the school budget. And they rely on federal reimbursement that's paid when a meal is served to a child. And then these federal funds don't cover the cost of the meal. So the school nutrition staff is up against all of these limited resources and also the negative perceptions of school meals that are ingrained in our society. And then on the flip side, students also face many barriers to accessing these nutrition programs. They're not given enough time to eat lunch, and they often lack access to breakfast if it's served before the start of the school day. And school meal programs were designed to address the neediest students, and by design are associated with poverty. So this has developed a deep stigma that prevents many students from eating, especially those that need the meals the most. And then there's also the rigid eligibility guidelines to receive school meals at no cost. These are very restrictive and leave out many ineligible students that live in food insecure households. According to Feeding America, around 40% of food insecure households are not eligible for nutrition assistance programs. And as I mentioned, prior to the pandemic, Maine had low rates of participation in school meal programs. And actually, compared to most other states, we look pretty good as far as participation in these child nutrition programs. We're actually 4th in the nation as far as the number of kids that eat summer meals. But clearly the system is broken. We're only reaching about 27% of eligible kids in the summer, and we're missing more than half of the eligible kids at breakfast and over 30% of the eligible kids at lunch. And so, in order to reach more children with these critical meals, we clearly need to change the system. And the way to do this is to change child nutrition policies or make new and better policies that address the barriers I mentioned earlier. So over the last decade, Full Plates Coalition has worked to address the low rates of participation across child nutrition programs by making state-level policy changes. And these include requiring high needs communities to provide summer meals. And this is actually why we're fourth in the nation for summer meal participation right now. We work to require high needs schools to provide breakfast after the school day starts. There's also a law that requires high needs communities to provide an after school supper or super snack so that children can have a third meal before going home at the end of the day. This eliminates the hunger gap that many children experience between school lunch and school breakfast the next morning. We also eliminated the reduced price copay for students whose households made just too much to be eligible for free school meals. We funded and expanded the local food fund to support schools to provide more local ingredients in their menus. We pushed for the expansion of school lunch times. We're working toward a statewide online school meal application and also exploring new ways for schools to collect family income data to move away from the heavy reliance on school meal applications. And most importantly, I think, last legislative session, Maine took the historic step to provide school meals at no cost to all students. And Maine was actually one of the first states to pass such a law. We were just a day behind California. And so what this law means is that starting in school year 2022-2023, all Maine public school students will receive school breakfast and lunch at no cost, regardless of their family's income. And this eliminates a huge barrier to participation, and studies show that making school meals a universal program results in more students actually participating, especially those that need the meals the most. And there are many factors that contributed to Maine's success in passing school meals for all, including a friendly political climate in the state. And the USDA's pandemic response included providing school meals at no cost temporarily. That's actually set to expire after this school year, and Maine felt that we could not go backwards and start expecting some kids to pay. We also had been working for years on child nutrition policy, as I mentioned earlier. And so we had been repeating our message over and over and over and used every child nutrition bill that we introduced as an opportunity to keep the conversation going around school meals and the importance of serving them at no cost. So even though this past session was the first time we introduced the School Meals for All bill, we had been laying the groundwork for years. And some of the key strategies that we used leading up to and during the legislative session included working with a team of experienced lobbyists. They had deep ties to Maine policymakers and a history working on food insecurity and child nutrition. And this is really important because in order to move policy forward, you need people to be on the ground, having conversations with decision makers every day that the session is happening. You really need people to be your eyes and ears in the State House, or this session, it was all on Zoom. But making sure that there are people there who are paying attention, having important conversations, and keeping your policy priorities the top priorities for decision makers. We also took every opportunity we could to talk about the importance of school meals and saying that message again and again about how they should be served at no cost to all students. We spoke at conferences like this one. We gave briefings to legislative leadership and key legislative committees. And also briefings to other key decision makers like Governor Mills and Commissioner Macon of the Department of Education. We met with the editorial boards from the Bangor Daily News and the Portland Press Herald, and both ended up writing opinion pieces endorsing the bill. And we also equipped partners and stakeholders from many, many sectors with talking points and opportunities to raise their voices in support of the bill. So that included educators, folks working in public health and healthcare, hunger advocates, school nutrition professionals, students and parents, and many others. And we gave them the tools that they needed to be able to advocate. So having template emails was really helpful so they could reach out to legislators. We created a petition that was really easy for folks to just sign on to, saying they supported School Meals for All. And then also worked with folks to write letters to the editor and op-eds. So providing talking points and templates and other tools really helps busy people to be able to take action. And then we also prepped folks to testify in support of the bill during the public hearing. And it was important to have partners and stakeholders from all of these various sectors voicing their support directly to decision makers. We worked with schools and community leaders in target legislative districts to communicate directly and regularly with their state senators and representatives, really keeping this issue top of mind throughout the session. And then we also worked with legislative leadership on both sides of the aisle to be vocal champions for the bill, and really capitalized on the supportive political climate that we had in the state last session. And I think one of the most important things to do is to lift people up to tell their story and to really make sure that impacted voices are included in this process, and hearing directly from students and parents who are impacted by food insecurity and who participate in school meals or don't because of some of the barriers I mentioned earlier was really impactful in moving this policy forward. And while we had a bill that passed with bipartisan support, and we now have a law, this law is written in statute, that school meals will be at no cost moving forward. Unfortunately, we were only able to secure partial funding. So we are still working on securing the rest of the funding needed to fulfill Maine's promise of school meals for all. And we're also very focused on implementation, which I think is the most important part of the policymaking process. When you pass a new law, the people that are going to be directly impacted by the law need support and often funding and technical assistance to implement new policies. So we're focused heavily on supporting schools and communities to implement all of the child nutrition policies that I outlined earlier. It's still an ongoing effort. And of course, school meals for all will be a big implementation push as well. And for some reason, it wants to go back in time. There we go. So child nutrition programs are federally funded and regulated. So ideally, the policy changes should happen at the federal level. Renee mentioned a few things that are currently moving and we expect to be moving federally soon. So we are focusing our efforts on advocating to our members of Congress, urging them to support an expansion of school meals for all at the federal level through child nutrition provisions that are included in the Build Back Better Act. I'm sure many of you have been hearing a lot about this lately. It's in the news all the time. Later this fall, we hope to see Congress take up the child nutrition reauthorization, and we hope to see support of the Universal School Meals Act, which would make meals free for all students at the federal level. And then there's some other important bills like the Healthy Hunger-Free Kids Act, the Summer Meals Act, and the Kids Eat Local Act. And as Renee mentioned, the Farm Bill is expected to be taken up, I believe, later this winter or in the spring. And this is the lever to make changes to SNAP and other nutrition assistance programs. So next up, we have Ken Morse. He's going to talk about making good food policy here in Maine. So take it away, Ken.
Thanks, Anna. Hi, everybody. It's good to be here, and it's good to see some old friends from my days working in public health, like Joanne and Doug, for example. I am the coordinator of the Maine Food Policy Work Group, and I'll talk a little bit more about that in a couple of slides. Next slide. So my job really is to talk about the food systems approach to policy that is diverse and tries to knit together all across the supply chain, the policy implications, as well as the seed, the social, economic, environmental, and diet, and all of those impact domain areas are critical. In the past, there's been many groups. We just heard a great story from Anna about Full Plates working on child nutrition, but some of these groups have worked on other bills related to food systems policy too. And the conversation got a real boost this spring when the Maine Food Convergence pulled together about 300 people for a month-long set of conversations about the food system, and policy was identified as a real key goal in that process. Next. So, as I said, the Maine Food Policy Work Group was started by the Maine Farm to Institution, and it's been active for a couple of years now. We pull together folks in monthly conversations about how we can support each other working on various bills. This year, we started to publish a newsletter which was pretty much weekly during the legislative system, and I'll show you a little bit more about that. Partly because of COVID and the Maine Food Convergence, our focus has not just been on food security or farming or maritime issues, but on many of the other sorts of things that impact the food system and the way the food system is tied in with equity issues and climate issues, especially. Next. So as I said, we published the food policy news. The one thing we've learned is that the legislative process is challenging for the regular citizen. It's hard to track things. It's hard unless you're part of a group that's really on top of it. It's really hard to know much about what's going on. So we started to track close to 100 different bills. And each week we would publish this newsletter. The newsletter not only had links to the advocacy groups, and you see that on the left-hand side in the red, so folks could go in and find out about that, but for pretty much all of the bills that we had identified to keep track of, the ones that had hearings that week, we would put them in the weekly newsletter. And for each bill, there are multiple links. There's a link through the LD number to the text of the bill. It tells about the sponsor. There's a link to the committee that's hearing it. And then there's a link to the YouTube so that you could watch the hearings, et cetera. Next. So this session was a pretty good session. We heard from Anna some of the food student hunger bills, which were great, and you know the universal meals being one of the first in the nation is really important. The local food fund, there had been a local produce fund, but it got expanded. So there were a number of bills that passed related to that. There were a lot of other bills, some of which are listed here. This is just a sampling of bills that are related to food security. But then there were also bills related to farmland access, to municipal recycling. That LD 1541 is also another first in the nation, I believe. That it's a recycling bill that compels large manufacturers to pay more of the cost of packaging, and there's a system being set up so that money then goes to communities to help with their recycling. So here there are a number of bills. We certainly don't have time to go into a lot of them. I would point out that there are a number of bills related to the Maine indigenous communities, and you know those are continuing to move forward, and some were mentioned already. But the other thing that was being worked on is that the there were some constitutional amendments passed. There's two listed here. One is it's generally called the Food Sovereignty Bill, and that is on the ballot in November, question 3. And then another very important bill is the Healthy Environment constitutional amendment, which is still working its way through. For constitutional amendments, they need 2/3 passage, and then they go to the main voters. Next. So there are a lot of bills that are still being worked on. Maine has a 2-year legislative session. So we're going into the second session starting really in December or January. And this is a list of some of the key bills that are being worked on. Was mentioned earlier, LD 1626. That's the Maine Indian Claims Settlement Implementing Act. That's a real important bill. And as you can see from this, the seed concept that we see food systems as being a lot more than just supply chain issues. And so we have been trying to take a look at lots of different aspects of the food system and the impacts of it. Next. We're now working on a new project, which I'll talk about in a minute. And one of the key models that we're looking at as a model for this advocacy project that we're working on is the Maine Environmental Priorities Coalition. This knits together over 30 environmental public health groups, and it works, like it says, to protect good health, good jobs, quality of life that our environment provides us. And it's convened by the Maine conservation voters. Next. This is a list of the members of the Environmental Priorities Coalition, and it's good to see Maine Public Health Association is one of this group. The important thing to see here is the diversity of the sorts of groups that make up the coalition. The way it works is the coalition meets each fall, and members present policy priorities, and the group has discussion and decides on a core group of legislative priorities. And what we have learned is that any bills that are chosen as priorities by the Environmental Priorities Coalition have a lot more oomph when it comes to working with legislators. And partly because, as you can see, all these different organizations with the diversity of where they're coming from, I mean, there's Trout Unlimited, there's environmental groups, there's health groups, these groups represent thousands and thousands of people, and that makes a big difference in the legislative process. Next. So we have started to work on this new project. We're tentatively calling it the Maine Food Advocacy Alliance project. It was proposed by the work group. It was taken on by Full Plates, Full Potential. It's being housed there, and it's being funded by the Elmina B. Sewell Foundation. The aim is to create something like the Environmental Priorities Coalition or a number of other coalitions that work in various states. We're taking a hard look at the Vermont Early Childhood Advocacy Alliance and how they work. The idea is to create a more powerful alliance to move food policy forward. And it's not just to move policy forward collaboratively, but it's to do training, advocacy training of members, and to create just more of the tools, communication tools that make a big difference, like Anna was talking about in terms of the advocacy work. So we are now, this fall, we're doing what we call a landscape analysis. We're kind of studying what the need is here in Maine, talking to a lot of different groups. We'll likely be talking to a number of folks that are in this conference now. And then we're also looking at key models, both within Maine and outside of Maine, as to how to really do a good job of this advocacy work. We're delighted to be selected by the USM Food Studies program as their class project. And so they are really jumping in and helping us with a lot of this research, and we'll be conducting interviews and helping us to find the results. Depending on what we discover, if we clearly establish that the need and the interest and the support is there to move forward, we will then launch a design team that will work over the spring. And then the hope then is that we'll be ready to launch in about a year, and that we would probably then hopefully have a food policy summit in about a year that would help set food policy priorities for the 131st legislature that starts in February 2022. And one of the things that that we're trying to do is really to reach out to many of the groups who have been underrepresented in policy work, folks with lived experience and stuff, and so that's a key goal that we have. Next. So this is just a summary of kind of the overall our overall goals to build popular muscle to create good food policy, and some of the key aspects of that relating to hunger and inequities, also just to bring our food system back home, to strengthen Maine's farms and fisheries, and to protect the environment and our climate. Next. So that is our presentation. Here are some our contact info, and also we put together a resource list which will be part of the packet that folks will get afterwards. So we're now wanting to try and answer any questions that you might have.
Thank you all so much for that great presentation. And it was a perfect segue from our last presentation on food sovereignty. And there are a few questions that link the two presentations together. One that people are interested in knowing more about is question 3 on the ballot around food sovereignty, and whether you know of any resources that people can check out to learn more about the pros and cons of the food sovereignty referendum.
So, yeah, I'm seeing the questions in the Q&A there, and it's funny, we talked about this prior to presenting whether or not we were going to tackle this one. But, you know, given that it is a ballot initiative coming right up, and we are not here to influence votes one way or the other, I do, you know, just from what I've been hearing and the questions, like I see the question 2 around question also around food safety and food sovereignty. I think one distinction that helped me was that folks may recall a couple of years ago, there was I think it was called the Maine Food Sovereignty Act maybe at that time. That was a bill that was passed before the legislature, and that law is already in effect, and that allows for direct grower to consumer sales in municipalities that choose to adopt that legislation, or what's the word I want? Ordinance, or whatever it is in each town. So that's very different. So that's direct sales to consumers. Whereas it's my understanding the ballot initiative is simply establishing the right to grow one's own food and save seeds, and has nothing to do with actual selling of food to anyone. So that's one clear distinction between the two. And I'll stop talking for a moment and see if Ken or Anna want to chime in, but I do have a couple of links that I'll share in the chat that have been helpful for me to kind of learn more about it.
Yeah, I don't know a huge amount about it. I've sat in on some of the hearings and stuff, and it's tricky. I think the movement to adopt these ordinances locally was one thing, but when you try and scale it up to the statewide level, it gets much trickier. And so I think there's a lot of questions, and there are some of the partner groups we work with have, like the Maine Farmers Market Federation, have been against some of this. So we'll try, and I wish we had more definitive information to share, but we'll try and find some and get it into the information that will be shared with you after this.
Thank you. Anna, do you want to add anything before we go to the next question?
No, I think Renee and Ken handled it really well. Thank you both for covering that. And I agree. I think folks should just do their research. I know that there are some groups, some animal rights groups who have come out in opposition of the amendment. And it is very complicated. So I'm glad Renee has some helpful links for people to do a little bit of research before they head out to vote.
Great, thank you. And thank you, Renee, for putting those in the chat for people to access. Switching gears a little bit, still obviously talking about advocacy. Are you involved in any advocacy efforts to support an increase in participation in other federal food programs, like the Child and Adult Care Food Program and WIC, that reach our youngest community members?
I'm happy to start with that one. So as I mentioned, we are a part of many coalitions and collaborations. So one that Renee mentioned is the Ending Hunger by 2030 initiative. And while that is looking at, the big root causes of poverty and all of the different factors that impact food insecurity, we're also looking directly at all of the child nutrition programs and nutrition assistance programs, including WIC and the Child and Adult Care Food Program. So Full Plates doesn't directly work on WIC, but we have partnered with folks that are, and a lot of the barriers that I mentioned in the child nutrition programs, school lunch and breakfast and summer meals and after school meals, those barriers kind of run across all of these programs. There's of course unique challenges in each program, but we can address a lot of the issues sort of across the board. One of the big ones is the complication of people having to fill out paperwork, tell their income story multiple times for all of these multiple programs. So there's been a lot of discussion around how do we simplify the process of applying for different nutrition assistance programs and other resources that families need, like main care, heating assistance. There's so many different programs that families rely on that they are eligible for, and they have to apply multiple times. So simplifying that process is really important in increasing participation in those programs. And then the after school meal program that I mentioned is actually a part of the child and adult care food program. So it's an offshoot, it's called the At Risk After School Meal Program. And so a lot of the barriers that we're addressing there are very unique to K through 12 schools, while the child and adult care food program is for child care centers and adult care centers. So while we're not directly working on that, there are many partners who are. So, but there are efforts in the state to work to increase participation in all of these critical programs.
Thank you. And it is really wonderful to see all the coalitions and organizations that are working on these efforts. To that end, how do you all stay coordinated and in sync and make sure that you have the same messaging? And if someone wanted to get involved in some of the work groups, which one's the right one? How would you direct people? And how do you keep that collaboration and coordination going?
I would say send your email to Ken so that he can keep you in the loop. He's done such a great job of tracking. So, I mean, there were just so many food related bills that were moving through the legislature this past session, and there are still bills moving through in this second year of the session. So, you know, Ken and the Food Policy Work Group is a great resource. You can also go to feedkids.me and sign up to get advocacy updates specific to child nutrition policy. We don't send very frequent updates or advocacy alerts, action alerts, but when there are things to do and time to raise your voice, we will send something out. So, but I would say Ken is the best first line of defense. And I know his email was at the end of our presentation. If you didn't catch it, I know that Heather will be sharing it out after.
Yeah, I would add, it's just my name, Ken Morse @mac.com. Yeah, if you go to the mainfoodpolicy.org site, there's an archive of all the newsletters. And in the newsletters, pretty much all the newsletters, there are links to the advocacy groups. So, and if you go to the Natural Resource Council of Maine or Full Plates or MOFCA or Maine Conservation Voters, you can sign up to get action alerts from them. And also for many of the bills, we put links into specific documents about those bills. So, and I think one of the reasons we're looking at the Advocacy Alliance is because we haven't had a really good way to determine the priorities. We're covering a lot of bills, but at a not very deep, some pretty deep because of our key partners. But so I think as we get this alliance up and running, there'll be a lot more, it'll be a lot easier to access a lot of the kind of information people might need to get engaged and become active in the policy work.
Yeah, I would just tack on to that, Ken. I think you're just really making a good case for an alliance, based on a coalition model, simply because I think we got a really good taste of it this session of how many direct food bills, but also related food bills, which kind of brings us back to that whole seed model, right? That, there can be bills that aren't even really primarily a food bill, but very much impact the food system and consequently our health as individuals. So, and there's just no way that we can all track all of them and be on top of it. So, when we partner with these partners who quite often are really on top of a handful of these bills, it's so helpful. We learn so much from each other and just being able to keep it all straight too. So great job, Ken, organizing us.
Thank you. And another question, shifting gears yet again a little bit, how do you evaluate your success in your advocacy efforts? Is that in terms of looking at academic performance outcomes, health status, return on investment?
That's a really important question. I'm glad someone asked that. So thank you. That is something that we are very fortunate to have. Just thinking about the child nutrition policy specifically, there is an outside group of researchers from the Harvard School of Nutrition who was very interested in this historic legislation in Maine and in California. So they'll be coming in to look at all of those various potential outcomes and indicators that this actually was successful, that it did everything that we said it would, that, you know, when kids have access to food, they can learn and they can concentrate and their health improves. So they'll be looking at those specific pieces, and they'll be comparing what happens in Maine and in California when our states continue school meals for all, compared to what will happen in another state when the USDA pandemic response waivers go away and they go back to having some kids pay for meals and others not. But I do think that it's very important to evaluate when you've, you know, it's important to implement well and then evaluate the success of your policy, because it does directly impact people. And if there's something that's not working the way you thought it would, you can go back and try again. I mean, the list of child nutrition bills that I shared, many of those have been introduced multiple times. Whether they passed the first time or not, we often go back and make tweaks to make them work better because we found out that it wasn't working. I think the local food fund is a great example. As Ken mentioned, it started as the local produce fund a long time ago. How long ago is that, Ken and Renee? It was a long time ago. It wasn't ever fully funded. It was, you know, there was never enough money to really make it work. And so we were able to secure some state funding, which was fantastic. But there were other issues with the law, that it was very limited just to raw, minimally processed produce. You couldn't buy any protein or dairy or other locally grown and produced foods. And now you can use those funds. Schools can use those funds to buy more local foods, not just produce. It expands how much they can get in incentive reimbursements. It changes how and where they can purchase the food. We learned from the directly impacted schools that it wasn't working and that they needed it to change in order to work better for them. So it was very helpful to learn and then make those policy changes.
I think that's a great example, Anna. And I think another one that came to mind for me when you were talking was, as we worked on universal meals, one of the unintended consequences that's being addressed simultaneously is kids have to, or their families have to complete a free and reduced lunch form that quite often call a school meal benefit form each year to qualify for free or reduced lunch. And now that's gone away. Families don't have to complete that form to get the universal free meals, but schools rely on that data for so many other programs. And so now the incentive to complete the form for school meals is gone, but schools still need that data. So there is an effort afoot to change, even just the name of that form from school meal form to school benefit form, I think. And so it's interesting to me how, different initiatives can have impacts beyond what they were originally intended. So, and that the work is never really done, right? We have to keep tweaking, like you said.
Thank you for both of those answers. And the universal school meals is such a success. So thank you for working on that. I'm not seeing any more questions at the moment, and we are just almost upon time. So I want to thank Renee, Anna, and Ken for being with us and presenting this morning and continuing the conversation on food systems and policy solutions. We've had a couple chats come through about people interested in joining your work, so we'll make some connections there. Another reminder, again, to please complete the evaluation using the feedback button. And we will be back at 11:30 to switch gears and talk about streetscapes and public health. So we look forward to seeing you all in 10 minutes. And thank you again to our speakers this morning.
Thank you.